Hello everyone, this is Dr. Tushar Mehta. I'm an orthopedic surgeon and a sports medicine expert from Gurugram, Haryana, Delhi NCR. This video today that I'm sharing with all of you is about a topic called as avascular necrosis. In short, we call it AVN. Uh, the reason behind this video today is that post-COVID, almost we're about to cover 4 years post-COVID in March 2024. So, despite those 4 years, I have seen a lot of cases coming to me with avascular necrosis of the head of the femur. I will discuss the reason and the correlation between COVID and this condition, but I wanted to discuss this topic so that it should be given away in public awareness, and most of you will understand what this topic is all about. Well, first of all, we will try to decode the word avascular. So, vascular means the blood supply, A means absence of it, necrosis means death. Necrosis literally in our biology language means death, so it is death of the bone. So, avascular necrosis is a condition, as you can see on your screen also, that where there is loss of blood supply of the bone leading to death of the bone. The death progresses leading to collapse of the bone. So first of all, the blood supply which is going, that starts cutting down, leading to death of the bone, and progression happens after that. Now, there can be two reasons behind this avascularity. I mean, the damage to the blood supply can happen either because of these two reasons. Number one, trauma. You had a hip fracture, you had a hip dislocation, or non-traumatic causes without trauma. We'll discuss them. But bottom line will remain the same. So whether it is trauma or non-trauma, the blood supply will be damaged, leading to death of the bone and the area around the bone, and the bone will collapse. Now, I am going to talk to the main point here. COVID, people had steroids. They were given steroids, they had steroids, oral steroids, IV steroids to an extent, because at that point of time, the steroids was one of the 3-4 life-saving drugs. So whether you had it or you were given, but definitely all prednisolone and methylprednisolone, which was given to you. See, normally we use steroids in other conditions as well: asthma, skin disease, immunological disease, post organ transplant. But at that point of time, the steroids which were given or which were taken are probably the reason today why we are seeing a very high incidence of avascular necrosis in our patients coming to us. And usually it involves both the hip joints. It starts with one, sooner or later it will involve the second hip joint as well. So that is the reason why I'm discussing this condition here today in the form of an awareness video 4 years after COVID, that even those steroids, when they were taken at that point of time, they are showing their deleterious side effect even today. Now, if you have AVN, what will be your chief complaint? First of all, you will have a pain in the hip. But that pain will not be a very pinpoint pain in the hip. It will be a diffuse pain, it will be a vague pain, and most important, it will be a pain which will travel to the buttock, to the groin, to the thigh, to the knee. So it will be a referred kind of a pain which will travel to the adjacent area around the hip joint. Second, you will gradually have a limp. Limp will not be noticed by you. First of all, it will be noticed by some family member or some friend or some well-wisher, that while walking, they might observe a limp and they might come and tell you. Third, you will find a lot of stiffness in the hip. You will wake up in the morning, you will be like, okay, entire body is fine, but in my right hip when I wake up, I feel a kind of a heaviness. Number four, gradually that pain, which I mentioned at the first point, gradually that pain will go to an extent that will wake you up in the night. So these are the 4 clinical complaints that normally our patients come with: pain. Second, if the condition is severe, pain that wakes up in the night. Third is stiffness. Fourth is limp. Now, I have categorically put up things here just for your, I put there as an illustration just for you to understand. So you can see the hip pain, the stiffness, all these things. Now, what should be done? First of all, whenever you develop some kind of such kind of a clinical symptom, and if you had steroids and all that thing in COVID, so first of all, you should consult a proper qualified orthopedic doctor, whosoever is available nearby. And what is the first most basic investigation? X-ray. Now, I want to tell you something again for awareness. Initially, X-rays are not going to be that helpful. So sometimes your orthopedic doctor who has seen you might even advise you that only X-ray is not sufficient. We might have to go for an MRI. So don't hesitate in that. Even though you have a pain, even though the disease has started, but the changes of the collapse of the bone might not be visible in the initial phase of the disease. They will be available, these X-ray signs will be available, they will be visualized only if the disease has entered into the advanced stage, like when proper, bone collapse happens. So X-ray is the first investigation for sure. It has to be done for sure, but in early stages, it is not that great an investigation. So therefore, the progression of AVN on an X-ray may be visible, may not be visible. Alright, so if the disease enters into the advanced stage, it is at that point of time that you will see gradual cyst here, you will see a cyst, you will see a cyst, you will see a cyst, and you will see a little loss of the bone, and you will see a lot of bone collapse. So investigation of choice will always remain MRI. I mean, you get an MRI done, you can diagnose avascular necrosis within few days when it starts developing. Not only it is important when X-ray doesn't show you anything, but actually for an orthopedic point of view, for me, MRI is so valuable that I will stage your disease, that you are in stage 1 or 2 or 3 depending upon the MRI. So MRI is the investigation of choice. Now when we talk about treatment, see, please try to understand treatment depends upon multiple factors. What is your age, what is your stage, what is your general health, what is your comorbidity, whether you take alcohol or not, whether you have any motor disease, like if you have any Parkinson or anything like that. So treatment will depend upon multiple conditions. One treatment fits all is not the criteria here. Now listen to this very carefully. I'm making this point very clear. As of now, what I have gathered in my more than 1 decade of experience, there is no medical, there is no surgical, there is no allopathic, there is no naturopathic, there is no physiotherapy, there is no homeopathic treatment as to which is available, at least in front of me on this planet, which can restore the damage to the blood supply of the head of the femur, which has already happened. It is irreversible. Please accept it. There is no way you can get the blood supply back. It is not possible. Initially, what you can do on your end is use a stick, use a crutch, put less weight, because the bone has already developed a disease which is damaging the blood supply. You'll put more weight, you'll damage the blood supply even more. Just take basic analgesics for pain. If you are going for higher analgesics, if you go for stronger analgesics, okay, fine. Many people do that. They keep on delaying treatment and they keep on popping pills, and that leads to another problem of liver and kidney in them apart from this disease. There is one category of drug, bisphosphonates. Don't think that, you might have heard of certain medicines ending with FOS available in the market, or your doctor must have given you. So don't think that it will give you the blood supply back. It is just that it will make a bone a little stronger, so it will reduce the risk of fractures, but do not expect magic. Blood thinning drugs, they can be used, they cannot be. Different people, different opinion. Eventually, surgery. So avascular necrosis has to be managed surgically, first thing. Second thing, as early as possible. Third thing, a person by an orthopedic doctor who has an expertise in that. You should be able to stage it properly on an MRI, because different stages need different treatment. But I'm not going to here discuss stages, as it's an awareness video. I'm going to just tell you that if there is no collapse, then the surgery should aim at increasing the blood supply. Very simple surgery. Those who have had AVN, those who have AVN, those are in the process of taking consultation with the orthopedic doctor must be aware of it. CD, co-decompression. So all we need to do is we just need to put on a blade and we need to take the pressure out and we need to restore the blood supply. That's all. But if it is an advanced stage, then you have an arthritic hip and you have to go for a total hip replacement, which is of course an extensive surgery. So moral of the story is, try to control the condition as soon as possible, try to treat it as soon as possible, try to get away with just a co-decompression and on stage 2A, because if you will take your disease to a higher level, then you will have to go for a higher surgery. So that is the moral of the story. I'm just sharing you a bit of a co-decompression. It is very simple. We make small holes in the bone so as to decrease the pressure inside the bone and increase the blood supply. That's all. That is the only purpose, nothing else. Again, it does not cure the disease, but it can retard, it can slow down the progression of the AVN. But if you go into an advanced stage, little advanced stage, along with co-decompression, we put a bone graft. You go to another advanced stage, of course, we go for total hip replacement. So post-operatively, all we say is that again, weight bearing should be delayed as much as possible, and these are the basic, pros and cons. And of course, then eventually, when things complicate, then entire hip needs to be replaced. So moral of the story, Steroid is a risk factor, irreversible, no medicine available that can restore the blood supply which is already damaged. uh, Try to get it checked as early as possible. If you have the red flag signs which I've shown you, get an x-ray, get an MRI. If it is stage 1, 2, whatever it is, get a core decompression done as soon as possible. Do not delay the process, otherwise you will have to go for a total hip replacement. I wish you all the best, and please like, share the video, and subscribe to the channel, and share with as many people as you can. And we will be coming up with more patient awareness videos on various important topics and diseases that we see in our clinic often. Thank you so much. Bye bye.